going to introduce Mark Kelman as Mark Kelman himself. He's going to talk about how to stop canine parvovirus from preventing us from getting them home. Mark Kelman is a veterinarian, research scientist and entrepreneur. He graduated from Murdoch University in 2000, working at the RSPCA New South Wales for 4 years, then Sylvania Veterinary Hospital for 2 years. He joined Virbac Animal Health for 8 years as Technical Services Manager, focusing on vaccines, where he created Disease Watchdog, Australia's national pet disease surveillance system in 2010. Does anyone here use Disease Watchdog? Put your hand up. It's just been closed. Oh no, well, it was an amazing resource. It was fantastic, and there were some incredible discoveries facilitated because of that. So, sorry to hear it's closed. He's fixing it. Okay, good. Awkward. All right. So in 2016, Mark started with a master's with the University of Sydney on canine parvovirus epidemiology and co-founded Paws for a Purpose, a social enterprise charity for pets and people. He also sits on the board of Pets in the Park. You were a co-founder? No? But he looks like one, so. He's gone the distance. That's what happens when you try to ad-lib these things. Don't do that. Note to self, don't do it. Okay, reading right back off this very safe bit of paper. He's also the president of the Australian Small Animal Veterinary Association. Yep, okay, got that right. Thank you, Mark.
All right. Yeah, so on the topic of Disease Watchdog, for those guys who were using it, since I left the Virbac Animal Health, they weren't able to keep resourcing the program, and as a result, some of the cases weren't still being put through. And the thing about these sort of voluntary disease reporting systems is if people aren't logging cases, there's no point running them without enough cases coming through. So the decision was made to close that program. At the same time, what it's done is it's given us the opportunity to I'm going to look to build another program specifically for Parvo. Disease Watchdog covered a range of diseases. We got a lot of data, and a lot of the stuff I'm going to talk about today is actually from Disease Watchdog. But at the same time, Virbac made the decision to close the program. All the data has been donated to the Vet Compass research facility, and it's all going to continue to be analysed, which is great. And there's a lot more research and things that are coming through. But at the same time, for people who have been logging cases into Disease Watchdog, now that it's closed, feel free to still contact me or to contact Vanessa Bars and let us know that you're having these cases, because obviously I'll share a lot of the research now, but we still want to hear about these things, and obviously there's a bit of a gap given that that particular system is no longer operating. But let me talk about Parvo, canine Parvo. So, like Anne said, I've been doing a lot of research for many years on Parvo, even before I started this research project. What was started as a master's has actually turned into a PhD. It was always going to be bigger than that. And this actual project is actually even bigger than a PhD. It's going to be years and years that this will hopefully go on for and hopefully make a big difference. My goal is to actually stop Parvo and to see if that's at all possible. I'd like to prove that it is. Many people say that it's not. In the very least, we can see if we can reduce Parvo cases down to the rate that we see distemper in Australia, which is actually quite low. We're very fortunate not to see that disease very much, whereas obviously overseas it's more of an issue. But Parvo is still a big problem. We're going to talk today about how big a problem it is, and potentially it's a bigger issue than what we think. So we've already talked a fair bit about Parvo. We've covered a lot of these things. As we sort of touched on earlier, most people in this room have seen the disease. You know it's a terrible disease. It's obviously a big killer of puppies. One of the things that makes it a big problem is the fact that it does persist in the environment. So it's not just the ability to spread between animals, but the fact that you can have a dog that has diarrhoea in the park, and that diarrhoea could last for 12 months, and any person walking through with their shoes or any dog walking through that licks its paws could potentially catch that parvo that was spread maybe even 12 months ago. So it's almost impossible to get rid of in the short term, but in the long term we can get rid of this virus through raising herd immunity, which is done through vaccination, and potentially we can get rid of it if we can change the way that we do that. Parvo has been around since the late 1970s. So the joke is that if you remember the 1980s and the bad hair and all that stuff, that's when Parvo came into existence. And it basically exploded around the world at the same time. It's crazy, and I've read all the papers. I'm not old enough to have been there at the time when it actually happened. But for those who were, literally there was tens of thousands of dogs in Australia alone dying from this disease, and across America I hesitate to think how many, probably hundreds of thousands, millions of dogs would have died back in the 80s, back in the late 70s, when this disease basically moved from just affecting cats to affecting dogs as well. In Australia, it certainly occurs Australia-wide. And again, we've talked about the clinical signs. One thing that's worth raising is that in the research that we've done, we're able to show that 42% of parvo cases that came into vet clinics resulted in the patient dying, which is a crazy amount. Of those 42%, 18% of those, so 18% of all cases, died from the disease itself. That's a pretty high death rate from a disease. The other percentage, which is the other 24% of those cases, died from euthanasia. So some of those animals were sick, too sick to be treated. Other cases, it was because the client couldn't afford to pay for the treatment or because the vet was concerned about the welfare of the animal. But, to have almost half the animals that are infected with this disease going to vet clinics, dying as a result of that, either directly or indirectly through euthanasia, this is terrible. This is a really bad thing. So in the shelter, just to touch on this, because obviously we're all here to look at how parvo is impacting on the shelter, there's a lot of reasons why parvo is not good for shelters. I was a shelter vet from the RSPCA for my first 4 years, my very formative years as a veterinarian. And, I know what it's like to have to deal with parvo, face on. It's terrible. In the shelter, we're obviously at higher risk because animals are coming in who are either unvaccinated or with an unknown vaccination history, so they're already at risk. The potential is that the shelter can also be a source of infection, so that adds to the risk as well. But also further to that, animals that are coming into the shelter often don't have good nutrition. They could be emaciated, really, really skinny dogs and kittens that can come in. They can be full of parasites, whether it's intestinal parasites that could directly affect their intestinal cells. They can have a lot of stress. All of these things mean they're at greater risk of disease. And so that puts them in another category, another further risk category for being affected by parvo. And then obviously there's a potential to spread within the shelter, which is why we're talking about the importance of cleaning. If we then do get parvo in our shelter, the delays in rehoming the animal as it has to be additionally housed and nursed and treated, the potential of risking the spread of disease, not just within the shelter, but externally as a result of foster carers or staff in the shelter that could be taking parvo home to their dogs or to other animals. The potential to have to close your shelter so that you can't be saving animals because you've got to get rid of this disease first. And I don't know, but I've heard it said that a lot of people are scared about getting a bad name, that if people think that the shelter has seen parvo or had parvo, they may not surrender their animals or bring them in because they're worried about going to a shelter that's had parvo. So there's almost this sort of social risk, this taboo that goes aside with parvo as well. And of course then there's the ongoing risk of stress for your staff. I know that having had worked in an animal shelter for 4 years, I needed a break because, year in, year out of seeing these cases of puppies that are dying from parvo, from kittens that are getting cat flu, it puts stress on us as well as on the animals. And so there's this, risk to your staff of being in these environments where you're seeing these diseases and nothing's being done. And that's one of the reasons why I decided, after leaving the RSPCA, I want to do something about this. I want to see what we can do to stop this disease. Why should we be seeing this disease every year in and year out? Why can't we make a change? That's what I'm working on. That's what my whole philosophy is. How can we make things different so we can change this? There's also obviously the costs of treating the animals that are sick. No one has enough money, and having to pay money to treat animals obviously is a waste of money when it could be spent on better things if we didn't have these diseases. And of course for the animals it's a terrible thing for them to go through. Now, having gone through all the terrible things about parvo, there is some good news. And it's one of those things that I think we've oversimplified for many years, but you guys can handle the truth. And the truth is that parvo is not always bad, right? And this is difficult because we just talked about the terrible situation. 20% of animals die directly from the disease. Half the animals are dying from euthanasia and disease. But in some cases, and like Alicia said, because of the dose effect, because of their immune systems, because of a range of factors, you can get parvo and you can actually be okay. So animals can test positive of parvo. Some animals you could send home and they'll actually recover. They won't shed for too long and they'll be fine. So not every animal that gets parvo is going to die from parvo. And that's something that we, I think as a profession, whether it's in the in-shelter environment or as vets, we're growing up to the realisation that we don't have to say that things are black and white. Parvo is not a black and white disease. Parvo is extraordinarily multicoloured and, there's so many different degrees and things we need to consider. And if we look at it, perhaps more complex, but at the same time in more detail, we can do a lot more with this disease. There's a lot we can do that's really good. It's not necessarily a death sentence for every puppy that catches it. We don't have to euthanize every puppy that has parvo. The other issue that we see is that parvo is not evenly distributed amongst society. In the capital cities, particularly the more affluent areas, we really don't see it. And obviously, from some of the research I'm going to share, in other areas it's terrible. It's really, really prevalent. It's really, really common. And so, this is one of the things we've got to consider, that where we're operating, we're going to have different rules in different situations because the risk of parvo is different depending on where you are. We also have seemed to show that having co-infections makes disease worse. We don't know whether it's because of infection or because of disease, so whether it's how much of the virus gets in or just the effect that manifests on the animal. But what we do know is that animals that are carrying other diseases are more at risk of being worse with parvo. And so the question is, we need to look at that when we're trying to treat them, and how do we do that differently. So having said all that, I want to talk about why I think parvo is a bigger issue than what we already realise. We talked about the feline panleuk. We're seeing some terrible outbreaks of panleuk. With kitten season coming up, we're concerned that the cat parvo is going to be a problem in the coming months. We've seen literally hundreds of cats getting this disease in the capital cities, which has not happened for many, many years. But we look at dog parvo, and from my work in the shelters in the RSPCA and when I was working in animal industry, I saw a lot of cases happening, but we don't talk to each other, so I think we don't realise exactly how bad the situation is unless we measure stuff and we start to look at it all together. So as part of this research that I'm doing, with University of Sydney, we ran a survey which lasted for half a year. We actually ended up ringing every single veterinary clinic in Australia, and a lot of volunteers and people helped with this project, which was amazing. We got responses back from around 570 people of 530 odd vet clinics. And we're able to show that looking at around 25% of veterinarians who responded, they saw between 4,000 and 4,500 cases of parvo collectively every year. And that's a lot of cases of disease. And this is just to show you, this is all the vet clinics who actually participated in the study. And this is just the spread of parvo, looking at proportionally through those 2 years. And you can see obviously the capital cities, it's not really going to show, but obviously we do get outbreaks around the capital cities, but some of these regional areas, it's potentially even worse. This is a big problem that we're seeing across the whole of our country, and I can just imagine what it would be like in the US and around the world. So we're still doing this analysis. Crazy. I do think you should do a PhD if you want to, but it's a lot of work crunching these numbers. We're still doing the analysis, even though it's been quite a few months since it's finished. But on the current estimates, which haven't confirmed yet, it looks like it's probably costing between $20 and $30 million to treat the patients that are being treated. And in many cases, people cannot afford these treatments. It's a huge problem. And it may be that the total number of cases that we're seeing could be 17, maybe even 20,000 cases in Australia, which if you think about it is a case every 30 minutes. So by the time we stop talking about parvo, another 4 puppies have caught it and 2 of them have died. That's how bad it is. Every minute, every hour, every day this is happening. So this is a huge problem across Australia that I think people just haven't been aware of. The good news is a lot of research has been being done, and a lot of this is from the disease watchdog that we were talking about earlier. So I'm just going to talk through a lot of the risk factors around parvo, a lot of the things that we have discovered. This will help you identify if you're in an area where potentially there's more risk. We're able to show that in terms of seasonal risk, summer seems to be the highest fatality, but autumn, across the whole of Australia, it seemed to be there was actually more cases occurring in autumn. Now this is going to vary geographically, so you guys may have slightly different happenings in your areas, but I think the take-home message from this particular paper was that parvo is not a disease. It is a disease that happens seasonally, but it's a disease that also can happen all year round. So it's something we need to be aware of and obviously conscious of. One thing that was interesting is that there was a significant link with socioeconomics. Now, we've been saying this for many, many years. We've actually proven this is the case. So there was a very high correlation with clusters of parvo disease and lower socioeconomic sort of rankings through different government analysis systems. So we know that there's a link with socioeconomics, which points us in, if we're trying to resolve this issue, these are some of the areas we have to be targeting. We know there's a geographic risk as well, and obviously we showed that in some of this later research as well. The black dots are clusters and the blue is postcodes. Obviously some postcodes are quite big, so the size of the blue in this one doesn't matter, but you can see where the clusters are occurring. It's not just capital cities, but regional areas are a big problem as well. And this leads to another paper which showed that there was twice the risk in regional areas And I suspect that a lot of you guys from shelters probably are regional based where you're seeing parvo. I can see nodding heads, which is affirming that's true. And we saw in this study more than twice the cases were occurring in regional areas compared to the urban areas, the city areas. So it's a big problem. Geographically, within those areas, there's a risk as well. So you can see here in the New South Wales maps, again, these regional cases. And this is just from Disease Watchdog data. I can tell you in all the capital cities exactly where the parvo cases are going to be more likely. So in Sydney, for example, there's a western belt from Penrith down to Campbelltown. In Brisbane, it's from Ipswich to Bean Leeds, that southern belt. Around Melbourne, it's a ring that goes around the city. We've all got areas where the disease is being more focused and concentrated. And this is the thing, these are geographic risks that we need to consider. If we're moving patients into these areas and they're not vaccinated, they're at risk of catching the disease. If we're moving patients from these areas, there's a risk that we're transmitting it to other areas. So these are things we have to think about. People often ask me about breed and is there a risk with black and tan dogs? Overseas data has shown that maybe there is. In Australia, certainly, we didn't show that specifically. We did show that there was a higher risk with hounds and non-sporting dogs. What I think is that there's probably breed lines, just like in families. There's families of people that are more at risk of different diseases. But certainly there is some association with breed, but in Australia, we haven't been able to show that there's an actual breed risk with black and tans. What we did show was that there was a risk with weather, and this is quite interesting because this often gets reported to us. We showed that there was a risk with recent rainfall, and we think that possibly recent rainfall, flooding, for example, maybe actually I see nodding heads again in the room, that might be actually spreading the parvovirus around, which might be the reason why rainfall seemed to be short, like recent rainfall associated with more disease. But then a longer term of drier weather was the other positive correlation. And we think that might actually be because if you don't have rainfall for a long time, potentially the virus is building up in the environment as well. But these are just some interesting factors. So these are things that you can think about. If the weather's doing this thing, you might look out for more parvo, perhaps be more aware for it. If you start to see disease cases, maybe test for parvo when otherwise you may not have. Now we talked a little bit about strain as well. And when it comes to strain, there is some research being done. It's an emerging area. Just briefly, like we said, 2A, 2B and 2C are the more popularly reported strains. The reason why we talk about these strains specifically is because these are the strains where there's a conformational change on the surface of the virus that affects the site where it binds to the cell. That's the reason why you hear about these things more than others. There's a whole range of other strains we don't talk about, so don't think there's only 3 strains of parvo. There's hundreds, there's probably thousands or millions, but these are the ones we like to talk about as scientists. Whether any of the strains are better or worse than the others, we haven't actually agreed on as scientists. I don't know if Alicia has a comment as to whether 2C is any better or worse. There's certainly conflicting in the research papers. Like Alicia said, in terms of the SNAP tests, they're all around 75 to 80% in terms of being able to tell you that a case has disease, but none of them is 100%. So like we said, false negatives you need to think about. If it looks like parvo and smells like parvo, it quite possibly is parvo, even if the test is telling you otherwise. And there's various reasons for that. I don't think I've quite got time to talk about it today. How long do I have left? Oh, I've got bonus time. This is exciting. 15 minutes? Wow. This is like my dream, to talk about parvo for longer than I have to. My girlfriend knows nearly as much about parvo as I do. So, well, that's great. I mean, maybe we can talk about it then. But when it comes to the testing, like I said, what the research has shown is that the SNAP tests, so the ones that you're using in a clinic or in the shelter, are all around 75 to 80%, regardless of whether it's an A, B or C strain. So you don't need to worry that the strain is the reason why it's not being diagnosed. You don't need to worry that the strain is the reason why you're getting all these causes or outbreaks or whatever. It's not a worse strain. It's probably the other stuff. You know, the vaccination hasn't worked. There's other factors. The vaccination's been done too early or you haven't given long enough. One point I will make is that some of the recent research has shown that depending on the vaccines used, it can take between 7 and 14 days for the animal's immune system to respond to the vaccine. What Alicia said was completely right, that generally animals will respond within 3 to 5 days. And when they do respond to vaccination, you see this massive increase in their antibody levels. But not every patient's the same. And when we look at a lot of these studies, a lot of the studies are focused around what the average does. But the average is not important. It's the outliers. It's the ones that will respond really well or really badly. These are the ones that are going to die from parvo. So we really can't focus on the average, we've got to look at the outliers. And when you look at the outliers, it actually is up to 14 days. So in some cases, particularly in outbreaks, where everything is being tested, and that's where you get to find out whether your protocols really work, in those cases, what you'll actually find is that you may need to tell people not to let their animals into an at-risk situation until 14 days after vaccination. Even 7 days may be too soon, and some of our research has shown that. One thing that we've recently published in Journal of Vet Micro was that there was no difference between the vaccines that are the CPV2 versus the 2B in Australia. They both performed exactly the same. So some would argue that one vaccine strain is better than the other vaccine strain. In Australia, we certainly didn't see that. In our research, they looked exactly the same, which is really good. It means the vaccines will work. It may be that the 2C strain could behave differently because that's only recently been cited in Australia, so we're not quite sure how that's going to go. More research is being done. So what I do want to do, talk about, and it's great to have this bonus time, is how to stop outbreaks from occurring, and then what we can do if we do start to see, outbreaks starting. So again, a lot of this Alicia has already touched on, but the first thing is if we can vaccinate all the animals coming into a shelter, that is great. That really is the best practice. But just a show of hands, who is vaccinating on entry? Can I just see if people are? That's really good. So probably maybe 40% again in the room. If we can be doing that more for those areas that aren't, like I said, I know that there's issues, there's costs, there's problems have to be solved to make it happen, but this is such an important thing that can stop disease cases. And rest assured, Parvo will come if it hasn't already. It's such an insidious virus that it's out there and it's going to come. Like I said, the 14 days for vaccine to take effect is a really, really important factor, particularly in these high-risk situations. And in the shelter, if we can do the revaccination periods for the shorter period, we tend to say every 2 to 4 weeks for normal situations, but if we can do it every 2 weeks, again, like Alicia had said in the shelter, just because that really narrows that window of the time when they might be vulnerable and they haven't actually had that vaccination, they could potentially catch the disease. Again, reiterating what Alicia said, great to see that we agree between America and Australia, recommending the same things. If we can foster puppies away from the shelter where appropriate, that's obviously a really good thing, but it has to be the right environment. So our foster carers have to be adequately trained, have to understand, what they need to do and take the right precautions themselves. In a high outbreak risk situation, then the only way to guarantee a puppy can't catch parvo is to have them in a clean room that has been fully treated. I say with bleach, but obviously you can use other products as well. And take your shoes off before you enter the room with the puppies, because like we know, it's very, very likely that the dirt outside is infected with parvo. Your shoes are just as big a risk of transporting it as bringing a dog that's got parvo and putting it into the room with the puppies. But if you can take your shoes off before you walk into the room, you can guarantee you're not going to spread the disease, provided it's not on your clothing or anything else as well. And obviously, don't let these dogs and puppies that aren't fully vaccinated walk outside or go outside. If you are letting them into the backyard to toilet, just make sure it's in the area that puppies with parvo or people with parvo on their shoes haven't been. Socialisation is obviously still really important, so we have to make sure that continues to happen. We don't want to save them from parvo but have them put to sleep because of behavioural issues a few months later. But we need to keep vaccinating while we do that. We shouldn't be not vaccinating because they're being socialised. Obviously, you've got to keep doing both. And if we have animals that do have parvo, obviously make sure that they are adequately quarantined and dealt with, and we discussed that in the last talk. So to keep puppies safe from parvo, we also need to look after the puppy's health as well, because like we said, having other diseases is a risk factor for parvo too. So if they're fully wormed, if they're treated for external parasites, if puppies and dogs are coming in and obviously they've had poor nutrition, then if we can feed them up as quickly as possible, get them as healthy as possible, that gives them a chance to have a robust immune system that they can then use to fight off other diseases, including parvo. Obviously, the stressful environment is an issue as well. Another reason why fostering at home could be a good idea if you can do that. Do you guys use DAP for the dog appeasing pheromone? Not so much. Some people do. If you do, this is something that you can use to help reduce stress, which could potentially prevent some of these other diseases that are stress-related, so that might be something you can use as well to help. Now, just in the time we have left, one thing that I think is really important, and again, this isn't what my research is focusing on, we're still analysing some data around this too. I think what's happening is a lot of the time the reasons why parvo, I feel, is spreading is because of social issues and social factors. So if we're seeing parvo, we have to make people aware that it's around. We shouldn't feel like we can't talk about this disease, because that's how these diseases spread. So if you are seeing parvo in your shelter, let the other shelters know. I don't know what kind of communication networks and things people have, but it's really, really important. Keep in mind that a lot of cases of parvo may well be what we say subclinical or low clinical, so they may not even show signs of disease, but they could still be shedding the virus, so be aware of that. But keep in mind that when animals have parvo, it's not your fault. I mean, sometimes things go wrong with shelter protocols, they can be fixed, but you're not a bad shelter because you see parvo. Parvo just happens. It's just one of those things that's out there. But if you do see a case, find out where it came from and let those people know that it could be a source of infection. Vanessa's example from earlier about the cases in Mildura where the feline panleuk was being transported to Melbourne, that was a great example of if she had not done that, it would have kept on happening. We all have the opportunity to see a case and try and trace back where it's come from. I've heard of cases from Orange being transported to Sydney and, it happens all the time. But if you're aware of it, every one of us has a chance to be involved in this initiative to try and stop parvo spreading by just taking a little bit of time, following it through, and by all means, let me know as well. This is basically my thing. This is one of my big things. So if you're seeing cases of parvo, if you're hearing of outbreaks, please spam me. Send me an email. My email address is there. It's kelmanscientific@gmail.com. Let me know that you're seeing cases of disease. I'll talk a little bit more about the last stuff that we're doing as well, but there's a lot of work that we're doing to try and stop these things. So especially because Disease Watchdog currently isn't operating until we get something back on, working again, just send me emails and let me know what's going on. So what we're personally doing is, I've got 3 hypotheses. This is a scientific thing. There's 3 things that I think are going on. The first is that I believe that canine parvo is as much a social disease as it is a biological disease. So I think that if we can vaccinate the right puppies and dogs at the right place at the right time, that we can reduce this disease and we can stop it spreading. Because that makes sense, doesn't it? So I think that the answer to social problems lies in social solutions. So, like I said, I'm one of the co-founders of a charity called Paws for a Purpose. It's a social enterprise. One of our key focuses is to try and stop parvo. We're also doing other things as well, but this is one of the key focuses for us to start with. And the way that we're doing that is obviously through this research that is being conducted through University of Sydney. We've actually got a dog treat that we're selling as a social enterprise. It's a premium beef treat. The idea being that we're raising money and awareness about this thing because so many people don't know about parvo. I mean, I'm sure everyone here has heard someone say to them, if only I knew it was this bad, I would have vaccinated. Have we all heard that said? Because I've heard it a million times. But if we can communicate on these things, let people know that it is such a big problem, this is the way that we can find solutions. So interestingly, if anyone's interested about the premium beef treats, come have a chat to me or send me an email. This is something that you can actually raise money for the shelter and raise money for Paws for Purpose at the same time for the parvo, so you might be interested. But the whole point is that the only way we're going to fix this big parvo problem is if we all work together. It's way bigger than me, it's way bigger than any individual, but if we all work together, imagine a world where parvo doesn't exist, or perhaps it's a lot smaller problem than what it is today. And that's what we're hoping we can achieve. So, time for questions, or maybe actually I think there's one more talk and then we're going to have questions. But just briefly before I stop, just want to acknowledge there's so many people who've been involved in this project. So it's just so good to have so much help. We couldn't have got to this point without all the help we've had, and there's a long way to go. But thanks to you guys for listening to the talk, and thanks to everybody who's participated, and let's see what we can do for the future. Thanks very much.